Hello everyone, my name is Haydar Khalil and today we are going to talk about Duchenne muscular dystrophy, also known as DMD. We have three objectives throughout the video: a crash course on Duchenne muscular dystrophy, a brief explanation on where the funding and research is currently going, and finally, why I think the research behind finding a good treatment and therapy for DMD should also be applied to the brain. Alright guys, so what is Duchenne muscular dystrophy? DMD is a disease that's inherited through the mother due to mutation on the X chromosome. That causes muscle cells throughout the body to break down quicker. The most common symptoms are enlarged calves and the inability to walk well. However, cognitive difficulties are often seen first, which leads to a delay in the diagnosis because they are portraying other issues first. Current therapies include physical therapy, steroids, and nutrition, and due to common behavior and social issues, psychological therapy and group therapies can also be recommended. So what is causing all this? Well, a moment ago I had mentioned a mutation on the X chromosome. Well, that specific area encodes for something called the dystrophin protein. And because of this mutation, boys with DMD, they lack dystrophin. Current research revolves around reducing these symptoms by either replacing the protein or substituting it with something else. For example, a smaller version of dystrophin called microdystrophin is being tested to see how it can help reduce the symptoms of Duchenne muscular dystrophy for a milder disease like Becker's muscle dystrophy. This is a great solution, and it is targeting the biggest issue with DMD, which is fixing the muscle cells. Alright guys, so we know that this is a muscular issue, and we know that the current research revolves around fixing this issue in the muscle cells. But when studies have shown that patients with Duchenne muscular dystrophy are also diagnosed with ADHD, learning abnormalities, anxiety, and autism spectrum disorder, we need to understand why this is happening. There is some correlation that is suggesting dystrophin is important in the brain. Dystrophin is known to be in specific areas of the brain like the hippocampus, the prefrontal cortex, and the cerebellum. Although in literature, the reports of brain abnormalities with Duchenne muscular dystrophy are inconsistent, the mice in the research of Duchenne muscular dystrophy are called MDX mice, and they're supposed to lack dystrophin. But these mice have been known to have less severe phenotypes when compared to patients with Duchenne muscular dystrophy. And this is due to a compensation of that lack of dystrophin with an upregulated utrophin in their muscle cells. So, can this be a reason why abnormalities were not reported as often? We don't know. But what this means is that we can either research this and find out whether this is the reason why, or we can suggest a different animal model and continue studying the effects of dystrophin on the brain. But the research still needs to be done. In conclusion, I would like to thank everyone for watching this video and thank all the wonderful people who are working on helping people with Duchenne muscular dystrophy. Tell me what you think about applying more funding towards funding a more detailed understanding effect of dystrophin on the brain. And finally, if you guys want more information on Duchenne muscular dystrophy, there are movements advocating for DMD who would love to talk to you and answer your questions. Thank you.